Well, welcome to the Cascadia Daily newsroom, right here in downtown Bellingham. We're here today with Jon Scanlon, candidate for the at-large seat for Whatcom County Council. So thank you for joining us today.
Thank you, Dean.
I'm Dean Wright. I'll be moderating this discussion. With me are Cascadia Daily News Executive Editor Ron Judd and publisher Cynthia Pope, who comprise the newspaper's editorial board. And I'd like to thank our partners at nonprofit community radio station KMRE for making this video possible. You can find them at 88.3 on the FM dial or streaming at kmre.org. In covering this election, Cascadia Daily News is using the Citizens Agenda approach in which readers have been asked to identify the issues they want candidates to be talking about. Ron, can you talk briefly about the Citizens Agenda approach and the process the newspaper will use in making endorsements?
Yeah, we chose the Citizens Agenda process, which has been used by media organizations around North America and various places for the last decade as a means to try to get issues on the table that people want to hear addressed by candidates in the era of professional campaign organization, which may or may not apply to this campaign. Campaign organizers have been very good about setting the agenda for issues that they want to talk about. And Citizens Agenda is a way for the public to sort of claw back on that. And we put out open call and for weeks at the early part of the election season to reader voters to tell us what they want us to ask candidates. We take a huge list of those and publish those in Cascadia Daily News and then have readers vote on those and pick their top 5 questions, which you've responded to here in writing. Thank you. And I know it's a chore to try to address some of these in the space limits, and that's one of the reasons that we have the interviews so you can expand on them. It was very successful for us last year. I feel like a lot of our readers really appreciated the fact that we were able to write, in addition to the usual campaign horse race sort of stories, issue stories, and have candidates from different races talk about issues that are important to local people. So we have those questions in front of us today, and we'll give you a chance to talk about those. But that's the goal for us in the program, and it's useful for us in deciding who to endorse, and also the answers to these questions and the thoughts behind them sort of guide our news reporting process about the elections, which is a separate process from the endorsement process. But we use the answers to help reporters know what to focus in on when they write their stories.
Thank you. And I'm a subscriber, followed the process last year.
Oh, nice.
I really enjoyed it. And there's definitely, I agree with you, there are things that came up that I have not been hearing outdoors or at other events. So I really appreciate that.
Good. Okay.
Well, let's go through the top, well, I hate to call them the winning questions, but the questions that
most pressing.
The most pressing questions of our readers. As Ron said, you had a chance to expand on your answers. I've never seen a candidate who wanted less than 150 words to tell his stories. First question was on causes of homelessness in Bellingham and Whatcom County and what we can do about it. You noted some policy ideas that you've supported, such as the Big Lift proposal, temporary housing. These are ideas that sort of address the symptoms that we find of homelessness. But you also talked a bit about addressing some of the root causes of homelessness, and I'd like to hear more about that.
Yeah, thank you. And the other thing I think I pointed out in my answer is that this is a countywide issue. It's not just a Bellingham issue, right? Because when you look at the data, it shows that there are homeless students in every single school district across Whatcom County. So I think this has to be a county-wide approach to addressing both the root causes, the symptoms, and then helping folks out. This is an issue I've been active on. I live in Bellingham, and I serve on a city commission that helps with affordable housing and homelessness services in the city. And I've learned a lot through that process and want to take some of that work countywide. On some of the root causes, most of the local studies as well as national studies show that the cost and affordability of housing is the primary cause of homelessness. And I think one of the best ways to prevent homelessness, it's simple, is to keep people housed. And there are a variety of ways to do that, from eviction prevention programs to some of the neat programs that have been set up locally around mediation between renters and landlords that started during the pandemic and look like will continue. To some of the proposals around rental reform in the city and statewide, I'm interested in looking at what that might apply like in unincorporated areas of the county. There are so many things to be looked at when it comes to affordable housing that I want to address. There are some things I think Bellingham has done pretty well, looking at the home fund. Barry Buchanan had an idea during his election this season for county executive of taking the home fund countywide. I like that idea, and I'd like to explore that with Barry and others on county council next year, working with the executive to see what might be a good fit for the county to get more funding and support for affordable housing across the county. Then there are other issues from behavioral health, substance use disorder, and the cost of healthcare. So I'm glad that there are questions now on the agenda about healthcare. On both mental health and on substance use, we do have some new funding coming in from the state for some of these issues. And then there's the ballot proposal in November for voters to take a look at, the jail proposal, which then will lead to new funding for substance use treatment and behavioral health funding across our community. But there's still going to be gaps. That proposal has about 4 to 5 year gap for funding. Ralph did a great job pointing this out in his recent article. So I think if elected, I'm interested in looking into how do we fill that gap. I think a lot of that is going to require advocacy in Olympia to get more state funding and advocacy in DC to get federal funding to come into our community.
Right, because as you say, it's not only a Bellingham problem and a countywide problem, it's a countrywide problem.
Yes.
And other governmental or other governments have a role to play there as well. You mentioned that the real root cause here is the affordability of housing, and one of the other questions is the affordability of housing. So let's just skip over to that one for a minute now.
Sure.
As you say, we do have an affordable housing crisis, but I'm wondering if it is really bigger than anything that can be addressed locally. Do we not have, here in Bellingham and Whatcom County, we have housing prices that are more in line with what you find in a metropolitan area, but we don't have an economy here that supports the kind of jobs that people need to afford those houses like they would in a metropolitan area. So given that big economic picture, what can local government do?
Yeah, thank you, Dean. And I agree. It's not just something for local government. It requires a partnership between local government, state, and federal government. I've been doing advocacy work my whole career, and that's something I would continue to do if elected, is to be an advocate and to be an advocate for our county. So there are some things that I think still need to change in state policy, some things need to change in federal policy, and counties can do that. Counties have lobbyists, and they work together to lobby in Olympia. They work together to lobby in DC. So I'm interested in being part of that process. As far as what local government can do, I think there's a lot when it comes to local reforms. So for example, the Business and Commerce Committee of the county has put together some really interesting proposals for affordable housing that include some local policy change, like changing up permitting to make it easier to be able to build, quicker to be able to build in our county. It takes too long to be able to build, and there's a lot of red tape. And I think some of that could be changed. There's some reforms out there that are possible at the county level, as well as partnering with all 7 cities to help them be able to get to housing quicker through their permitting processes. I mentioned funding earlier. I'm interested in looking at that to see what type of local funding options there are. We do take advantage of some funding options in state policy that are allowed for a county. So I'd like to see what else there is possible to get more funding for affordable housing locally. And then I think the other part of it is where we build. And so we have an opportunity where we're updating our comprehensive plan. We have to send that update to the state by June of 2025. And that's our opportunity to look ahead over the next decade or two and think about where do we want to build and how do we want to build. In my thinking, in my view, the best way to build is to build dense in our cities and in some of the urban growth areas that make sense. So some of those examples would look at places like Marietta, Alderwood, just outside of Bellingham city limits. It's in an urban growth area. Some of the spots that continue to go up the guide that are in urban growth areas that have been discussed in the past, I think some of these projects in the past haven't penciled out, and I think they potentially could pencil out now that the state legislature has made zoning changes. So as Bellingham now has to comply with state law saying that you have to go 4 units per lot, 6 units per lot zoning-wise if 2 are affordable. That changes that calculus. So I'd be interested in going back to some of the studies of urban growth areas which were prior to the zoning change and see what's the difference now. Do these projects pencil out now that the zoning changes are different than where they were when those calculations were done in the past? And that's a partnership between the county and the city of Bellingham. Some of the other cities are interested in expanding too, but I would want that if they are expanding into urban growth areas, that they're doing it in a dense way. It can't all be giant lots. I think the best way to protect farmland and to think about water resources in our county is to build denser within our cities and urban growth areas. So I think that's another way that can help with housing supply issues, which can then help with affordability.
And that certainly relates to the other question about how to preserve Lake Whatcom and its quality. One of the things that you answered was that we need to increase the protective forest canopy there. And one of the biggest problems there has been development in and around Lake Whatcom. So talk a little bit more about how your plan would preserve Lake Whatcom.
Yeah, thank you. And I live in Bellingham, so I drink Lake Whatcom water. That's my water source, so I care about it for my own health and safety, and also as a ratepayer, that it's a lot cheaper to clean up water that already is clean and cold. So I think there's that cost perspective, that financial perspective as well that I look at as an individual and as a citizen, a local resident. The Lake Whatcom water issues require partnership between the city of Bellingham and Whatcom County, given the jurisdiction that's in place. And there is a process for those discussions to occur. And so, as I said, I do like some of these ideas about protecting more forest land around the lake. And as we're learning this week with the fires, we also have to be smart about forest management policy. And I think there is a way to have smart forest management policy that helps protect against fires through selective cutting and thinning as opposed to clear cutting. So I think there's some of that we can put in place, not just for Lake Whatcom, but all across the county. Some of that will require partnerships with the state, given DNR's lands that they own, and private entities that own land around the lake and around the county. There was a recent debate in the city around the moratorium on development near Blow to Donovan. I support keeping that in place. I don't think it makes sense to continue to build within the watershed because it's just going to add that cost for ratepayers. That the more and more we do build in the watershed, the more you then have to clean the water. So I support the moratorium, and I think one way to help with the housing demand issues is, like I was saying earlier, is to build densely elsewhere. So there are some urban growth areas within the Lake Whatcom watershed, and I wouldn't want to touch those. I think there are other areas that we can build and build densely that can help with our housing supply.
We actually heard some proposals about building new cities. Outside of the urban growth areas, places that where you could basically build from scratch and start anew. Any thoughts on that?
Yeah, I know there's been this idea around Custer.
Yeah.
Where are some of the other areas you've been hearing about?
Custer, up near Sumas.
Yeah, I think it's worth studying to look at, but I think first we can meet a lot of our housing supply issues in the cities and in the existing urban growth areas without having to go into new spaces. I think if we can make some of those policy changes on density and then plan for it over the course of our comprehensive plan update, I think that'll help us to achieve a lot of the housing goals that we need in the county. There is this state statistic out there that we need to build 34,000 housing units in our county over the next 20 years to achieve affordability. A certain percentage of those have to be affordable for folks at a certain area of income. I'm interested in setting that as a goal for our county as we plan forward with the comprehensive plan update. And we can look at the data and see, okay, if we build densely, if we make changes to zoning, does that help us meet those goals? If not, then that's probably the time to look at, are there other places that we could build? Looking at other places, I would want to make sure that we're not doing it in critical areas. We're not doing it in floodplains like we've built in the past. Because it has to be safe and it has to be sustainable. And I'd also like to see, if we are building new communities, how do you do it in a way that's along bus lines? So it's not creating car-centric communities, so that people can walk to services and get to their jobs. So I think that if we do end up building in new areas, I'd want to build in that way, in a climate-friendly way, a dense way, with walkable, bikeable, transit-oriented neighborhoods.
Okay.
Yes, let me quickly follow up on that. The county executive was telling us yesterday that from his perspective, a lot of the available land inside current UGAs is spoken for, being developed, or it's in a sensitive area. So he was talking about this concept of start from scratch somewhere else. But your comment about state zoning changes, sort of redefining density in existing UGAs, is interesting to me. How likely, is that something that's in process or just discussed at this point? It seems like it's key to your idea of staying inside the current boundaries.
Well, Bellingham City Council is looking at this because there is, under state law that was passed this session, they have to comply with the state law. The question is when.
That's what I was going to ask, is how imminent or realistic is that?
Yeah. I mean it's law. I don't think the city of Bellingham wants to be involved in a suit with the state. So the question is when are they going to comply?
Right.
There are some interesting proposals, I think, in the city of Bellingham regarding additional affordability mandates that some of the city council members have been looking at. So I mean, that's a question for city council as far as when they're going to comply. I'd rather see them comply earlier, which then helps. And then I think that helps in that discussion between Whatcom County and the city of Bellingham regarding the urban growth areas.
Right.
So, I think some of these ideas around new cities, I've heard about some of them, I've talked with South Paul about some of them, but we can be informed by data.
Sure.
So I'd like to see the studies updated on the UGAs to see where the growth potential is when it comes to housing, and see if it matches up with the need in our county.
I was also interested in what you said about Lake Whatcom. It seems like there is a political opinion out now that Lake Whatcom is at the stage where limiting development on the lake is not sufficient to ensure the water quality long term, and that it needs to be clawed back, right, and return land to pervious surfaces. And do you think that's a realistic goal?
It's tough.
Or should it be?
Right?
Does it need to be, I guess?
I don't know enough about the data. I'd be interested in seeing the studies. So if you did claw back some of the land, what would the impact be? You can study that.
Sure.
But some of it you could do by attrition. Potentially partnering with some of the land trusts that we have locally. That could be one way to do it, by attrition. I live in the Columbia neighborhood. Down the end of one of the streets just above from Squalicum Creek, there's a family that has decided that when they pass away, their property is going to turn into a park.
Right.
I mean, there are conversations like that can be had. I think there's really innovative financing when it comes to land conservation that can both support those families while providing more land for conservation to help save the lake water. So I'd be interested in hearing more about some of those ideas. I know there's some other ideas, for example, along the Skagit River, Forterra has some interesting proposals for some of the communities that live along the river, Hamilton and Lyman and some of the other communities where they've purchased land at higher ground and are partnering with landowners there. I mean, that's something that we might be able to partner with local land trusts and potentially some of the larger statewide or national land trusts to help save some of those lands. And also I'd be interested in looking at some of those ideas for some of our floodplains.
Okay. Interesting.
There were two questions from readers about Peace Health. We'll just treat them as one. Has to do with the impact on healthcare in the county, that having a monopoly and only one hospital. You mentioned that you think one possible solution here is to have a public hospital district. that also comes with some costs to it.
Yep.
Can you talk about how that would help and what the risks would be?
Yeah, thank you, Dean. And this question, I'm so glad that people are asking about it, and you all have been covering this. And there's been so many letters coming in.
Yeah.
I read those letters that come in that are published. My wife is leaving her job at Peace Health. So when we moved here, she started to work at St. Joe's as an obstetrician. She's leaving there to go to Skagit Regional. She also started her own solo private practice in town. So this is a personal issue for me and my household. We've been having discussions, about healthcare in my household since we met. We've been together for 20 years. We met when she was a first-year med student. And locally, I've learned a lot about our healthcare system and about Peace Health just at my dinner table. And our friend network. Our friend network is a lot of the doctors, healthcare professionals in our community. Mm-hmm. And I think there is so much more that I know about that business. And there's toxic leadership in that business. And they have allowed toxic leadership to rise within the ranks. A lot of folks don't know, there are only about maybe 14 OBGYNs in our community in Whatcom County. 5 of them are leaving. And they're leaving because of decisions that were made in Vancouver where there was very little interest in local input. And those decisions were made based on business, not based on patient safety or healthcare outcomes. This is true across the healthcare industry. It's not a good place. We see hospitals closing. Actually, Peace Health is closing one of their hospitals, I think in Oregon.
Right.
And so it is an industry that is struggling right now, and I get that from being the spouse of a doctor.
Yep.
And you can also treat your employees well, and you can elevate leaders that want to hear from their people. And I think you can separate those two things. And being with my wife for so many years, I've seen better healthcare systems, just as far as how they treat their people. And that stuff matters. So there are some leadership changes. I hope that some of the new leaders that have come in are looking at that. I wonder how much of this is due to the pandemic. There was a lot of stress for people working at the hospital. They fired a whistleblower within the first few days of the pandemic. That stuff, they had a big fight with the nursing union. There's another organizing effort going on at the hospital right now. So, there's a lot that's just been going on at that facility, and I wonder maybe as we come out of the pandemic now, maybe there'll be some more stability and maybe some new leadership can make some changes there. So then the question comes back to, what can county government do? What can local government do? I think we need more competition in our healthcare marketplace, and we can call for that. So for example, I think one thing that a county can do as part of economic development policy is to reach out to other businesses and to say, hey, here's some available land in our county. And we do that. Our county executive does that with other businesses. We could do that in healthcare as well. To talk with some of the other healthcare companies that are present in our state, some that aren't present in our state, to talk about some of those options. What are some of those barriers to bringing new healthcare options into our community? A county of our size, having just one hospital, with the number of beds that we have, we see the limitations. Our ER is full so many different days. Some of that is local issues, some of that is national issues like the fentanyl crisis. I think there's a lot that we can do to help with the burden on the ER and help with the burden on EMS service providers in the community. And that's why I'm interested in the public hospital district idea. Some of the other counties that are of similar size to ours and have similar healthcare situations, such as Kitsap County, similar size of us, one hospital. Yakima County is also looking at the idea of a hospital district. But what they're doing, in particular what Kitsap County is looking at, is rural healthcare. And that's something I'm interested in looking at, whether it's through a hospital district or elsewhere. A lot of the rural communities and small cities in the county have lost primary care, which then means people have to drive further to get to their doctors, and then you have more of a burden when you're not getting some of that preventative care. You have more of a burden on EMS services, ERs, and emergency clinics. And I think we can help relieve that burden by having more primary care in rural areas. So I'm interested in studying this idea. I have been reaching out to leadership in Kitsap County who are exploring this issue. I've talked with some of the folks who created some of the hospital districts in San Juan County, which was a very similar idea to have rural health care in San Juan County and some of the islands that didn't have or were losing health care. So it is one way to potentially help with some of the healthcare needs in our community. And I recognize that at some point that may lead to going to voters for a property tax.
Right.
I'm very conscious of we've had a number of property tax increases, sales tax increases that may be coming depending on what happens this fall with the ballot initiative. So I'd want to be really conscious of that because we live in a state that has a regressive taxation system where relying on sales tax and property tax at the local and statewide level, there's a greater burden on low-income families and middle-income households. So I want to be very conscious about that as we move forward. There are some hospital districts that have never even asked the voters for increases. So for example, the hospital district that governs Skagit Regional in Mount Vernon only went to the voters for the very first time last year to ask for property tax. Voters sent it down. They didn't vote for it. So I think there's a lot to be learned from there. But there are some hospital districts that are able to operate healthcare facilities without having any tax revenue come in from residents.
So you're talking about hospital districts being a facilitator of rural healthcare? Are those two separate issues, or are those connected in your scheme of?
Yeah, I think those are connected.
Okay.
Because a hospital district, the way it's written under state law, they can do a lot of different things.
Right.
And mostly they're a contracting mechanism.
Okay.
So they put out a request for proposals. We would like to have XYZ in our county, and the
Right.
bids come in. So Peace Health does operate under hospital districts. So for example, the facility in Cedar Woolley is under a
Right.
hospital district, and they contract with that hospital district. And that happens in other places around the state as well. So it's really more of a contracting mechanism.
Right.
But what you start out with is, what is the need in our county? What are the gaps? So that's where I'd want to start out is, let's work with the health department, put together a survey, put together an assessment of what the needs are in our county and how can we fill those gaps.
Okay, thank you. It's clearly an issue important to our readers. Because
Yes.
It was, with so many questions on that, so many letters to the editor, so much coverage. Ron, some other issues.
Wow. I'm still pondering the rural healthcare issue. We have not heard another issue in our scant, not quite 2 years here, that's gotten the public animated to this degree. The other piece of the healthcare thing, obviously, that's on the table. So I have two follow-up questions about that specifically. One is, since we're on the subject of the hospital district, in your research about other places, has the formation of hospital districts been something that's been active in recent years or in the past? And in those cases, who usually has initiated those efforts? Is it county government people, like you'd be a county council person, or is it citizenry that are bringing these up, or is it both? What's been the motivating forces behind these?
Yeah, so the first hospital district in the state was in Renton that created Valley Medical Center,
Okay.
which is the first place where my wife worked when we
Okay.
moved to Washington State in 2010.
When was that? Back in?
Valley, I think it was in the 50s.
Okay.
The state law, the RCW, has been around for a while.
Right.
So there are 56 hospital districts across the state. Some started to actually build a hospital. In more recent years, they've been used for things like rural healthcare clinics. Some have helped with workforce staffing, and some do more public health messaging. So there's a variety of ways it's been used. And depending on the location of the district, that drives who starts the process. So if it's fully within one county,
Okay.
the county council can start the process. You
Right.
can have some that cross county borders, which probably doesn't make sense because Skagit has 3.
Yeah.
They're all along the border. And actually the Cedar Woolley district, it does actually represent workers up at the dams
Really?
Yeah.
Interesting.
So the folks, the PSC Seattle City Light workers and folks that.
So you use it to form your own health district that's based more on regional realities and residences than county lines, if necessary.
Yeah.
Okay.
So it can be a citizen-led initiative. It can be a council-led initiative. You can go either way.
Okay.
And we have Point Roberts.
Right. That's
Point
true.
Roberts as a
Yes.
district that was created locally when the folks who were running the clinic were going to retire. There was nobody in place, and they said, we need health care in our community, so that's why they decided to go with a hospital district to fund and keep that facility operating.
The other part of it that's sort of the elephant in the room with the Peace Health question is the tax exempt status, or somewhat exempt. And I've heard from different candidates and from the public a lot of talk about that. And it's been an issue here, as you know, I'm sure, for off and on for years. And it's been argued both ways. How do you feel about that issue? And specifically with the county executive told us that he doesn't feel that you can sort of single out healthcare as losing a tax exemption when all the other nonprofits in the area also have tax exemptions that benefit them. And how do you pick just healthcare out from that field, and not so much in a legal sense, but in just a ethical, public sense?
And can I ask you on this too? So I am aware of the past city effort on this that got shot down.
Yes.
Has the county ever explored this? And
I don't know.
And
that's a really good question.
Yeah, and that's what I'm interested in learning, because I'm not even sure if it's even a county question.
It may not be. We're going to have some
city is
reporting
looking
on
at
this issue in coming weeks where we'll ask those questions.
Because I've never seen it come up as a county question. I've seen it as the city tax exemption.
Has dealt with this very specifically before, yeah. Probably because Peace Health has facilities outside the city limits, though, so I don't know how it applies there.
Right, and they've got the new facility in Linden.
Yeah, so really the argument, the previous argument that happened here in the city was mostly specifically about the tax exempt status of the hospital.
Yeah.
And they did sort of claw away at it a little bit and made a compromise, if I recall, when that happened.
Right.
It didn't fully remove it, but it's seen as a tool to increase competition. You talked about the need for competition.
Yep.
So if this was just in the sense of general local government, do you think it's fair that they have this tax exemption in our modern healthcare economy?
So I think the question that I have about it is, what's the result? We know we've seen declining healthcare services in our county. We've seen Peace Health cut services. They'll reestablish some when there's outcry, right? So my question is, would it lead to better and more healthcare services in our county? I don't know. I think it's worth exploring. I mean, they say, and we hear this from hospital systems all across the state, that they're losing money. Well, that's another revenue loss for them, because they would have to make an expenditure. Would that then lead to other cuts in services?
Right.
And so I would want to know, well, what's the goal? I get why people want to get back at Peace Health. I'm pro-choice, right? And looking at their services and how they provide things. Now, my wife has never had an issue in her practice at the hospital, but given the nationwide status of abortion, the nationwide status of choice, the nationwide status of reproductive rights, I am on the lookout for making sure that we still have those services in our county. And we do have that through Mount Baker Planned Parenthood, and I would want to make sure that they can stay here and they have the operational environment to do that. So again, I would look back at the question about Peace Health as well. What's the outcome?
Yeah. Okay.
I mean, I think there could be a negotiation. And I think there should be a negotiation where there should be discussions between city and county leadership with Peace Health to build a relationship and say, how is it that we can provide better and more healthcare services in our growing county?
We've also heard talk recently from Peace Health, in fact, in a communication they put out last week about sort of understanding that maybe there's a need for more local communication with them in the form of a health advisory board, which I guess used to exist and doesn't exist functionally anymore. Do you have any thoughts about that, and who would sit on that, and would that help?
I think that would be helpful to bring back. I really like that idea of bringing that back. And I think part of this goes back to what I've just seen in my own household, where Vancouver isn't always listening. They say that they see us, but are they listening? And I don't think they're listening. So I think if that helps for the local leadership and the leadership in Vancouver to actually listen to the community as far as what our needs are and where we're growing, I think that could be helpful.
Okay, thanks.
Are there projects that you would really like to spearhead if elected?
Yeah, thank you. Several. So this is one. The healthcare question is about how we tackle the healthcare question and the gaps and needs in our county. That's something that I definitely see as achievable over a 4-year term. At least getting the plan together. We're not going to fix the system. Yeah. It's a national system, but putting the plan together, I think that's something that could be done in a 4-year period. And the other one would be housing. So partnering with others. I know Barry Buchanan is interested in this, and I'm really happy to see how many housing advocates are running this year, both in all of our cities across the county and at the county level. So I think we're going to have this moment to push forward on housing and affordable housing county-wide over the next 4 years. So that's another one that I'm interested in.
Well, I know we have a number of other substantive issues to get into. I know Ron is quite interested in hearing about the jail.
Sure.
But before we do that, maybe just something a little more personal. We all have people who have been huge influences on our lives. Do you have a hero, a heroine out there?
Yeah.
Who's made a huge impact on your life?
Thank you, and I think, because I think for me, running for office is personal. And a lot of it is based on how I grew up and the people who raised me. And I was raised by a family that was very committed to public service and community service. My dad was in the Navy when I was young. He's the son of a World War II naval service member. My maternal grandfather was in the Army. And the person who, I think two of the people that really more showed me the way, they didn't always say like, hey, you have to do this, you should do this, were my mom and my grandmother. So my grandmother, who we lived with after my grandfather died, this is my mom's mom, she was a leader in the community where I grew up. She was on town commissions. She was on the Chamber of Commerce. She ran a small business. She was a real estate agent and ran the business out of the house. Mm-hmm. And my grandma was always at meetings. She was always involved in the community. And it was just something I saw and grew up around. And to me, it was normal. Mm-hmm. This is how you're involved in your community as you show up. And my mom as well. I grew up in a town in Western Massachusetts that has the old New England style of government where you have a town hall meeting. Uh-huh. Right. 300 citizens or so are elected every year to vote on the budget. So my mom was one of those folks, and they come in. That's the legislative body for the town. And so, your elective district is maybe 8 people vote for you. And you go in. So I grew up around that. And my mom also is elected to the library board. So the library is governed by an elected body. So I grew up around that, and they inspired me to be involved. So that led me to my career of public service, working in state and federal government. Early in my career, I worked for a governor, I worked for a U.S. senator, I worked at the State Department, and then going into running advocacy campaigns on human rights issues at nonprofit organizations in the humanitarian aid space. Mm-hmm. And now I do consulting work with tribes and conservation organizations around human rights issues related to oil, gas, and mining. So they inspired me in my career and how I show up.
You're talking about the New England town meeting style of government is really interesting because, as I'm sure you know, elections have become very nationalized, local elections in this country, as part of the continuing polarization. And it seems like maybe I'm wrong on this, but it seems like that is not so much the case in Whatcom County and Bellingham. And I'm wondering if you're thinking that, are we different from other parts of the country in avoiding polarization? And if not, what can we do to prevent that kind of polarization where we have people, thinking that members of the opposing political party are evil rather than just having different views on policy.
Yeah, I think some of it is relationships. I think you look at our county council, while it's nonpartisan, everybody knows who's who.
Yeah.
It's a 4-3 progressive conservative council. We know that. You just have to look at endorsements, and you can see that in my race. I'm endorsed by Whatcom Democrats. My opponent is endorsed by Whatcom Republicans. So we all know that, and I think the people who are active, know those differences that are there. But I think when it comes to actually working with people, you see how in the council, not every vote's 4-3.
Yeah.
There's a lot of 7-0 votes, 6-1, 5-2, and so on. So I think, one thing, I had a former boss who taught me, in one of his lines was, "I have no permanent enemies." And I think that's what you see when it comes to votes, and when it comes to not just a vote, but building a relationship and building a partnership with someone. So one of the things I did very early on was I sat down and talked with every single current county council member, no matter who endorsed them in the past. Kathy Kirschner and I agree on a lot of these healthcare issues. Kathy is really interested in elder care in our county. That is something a hospital district can help with. Tyler Bird and I talked a lot about the role of a legislative branch of government for oversight. That's something I believe in. I worked for a United States Senator and saw how that works. It's a little bit different when it comes to a county council, but I think there is a role for a legislative branch when it comes to oversight. So I think there are ways to partner with people, and I think people have showed that. One of my early meetings was with Scott Cordice, mayor of Linden, and I sit down in his office, and at his desk it's a picture of him and Donald Trump, right? I'm a Democrat. I was on the board of Whatcom Democrats. That's not something he and I would ever agree on, but Scott and Linden are doing some really interesting things when it comes to housing. They've been building some more multifamily, denser areas within city limits in Linden. So, there are always ways to partner with people on different issues, even though if you know their national politics or their statewide politics.
Right.
And that's something I've been doing my whole career, building big coalitions. At one point, my colleagues sent me out when I was working at Oxfam to go build votes for some legislation we were trying to put together to make U.S. humanitarian aid more transparent for taxpayers and for people in developing countries. And my job was to go to Republican districts and get those votes. So I spent a lot of time in conservative areas around the country working with conservative members of Congress. Mike Pence was somebody I partnered with when he was in Congress. Marco Rubio, there were so many others that I partnered with to get that legislation through.
Okay. Ron, I know you had some questions about the jail and how this will be paid for.
Yeah, it's, I know, a deep, murky subject, and we don't have time to get deep, murky on it, but your general thoughts about the jail question. And we've kind of established with other candidates and the executive candidates and other people that, a lot of what seems to be on the table with the jail / services.
And I appreciate.
Trust in local
And I
government.
appreciate that you all are doing this.
People
Appreciate
stepping
that you all are
forward to
doing this.
establish
Appreciate that you all are doing this process.
Trusting the local government authority will have a huge role in this.
I was
in
really
deciding
excited
what
watching
happens
it
to that
last.
money.
Really excited watching it last.
Should
Really
they trust
excited
the
watching it
government
last
to
year.
do that?
As a
Do you think they will? And if so, why should they trust you?
As a reader, as a subscriber, as a subscriber, as a subscriber, as a voter, as a voter, as a voter, and I am definitely interested in your endorsement. Definitely interested in your endorsement. Definitely interested in your endorsement. You're a trusted institution. You're a trusted institution. You're a trusted institution. I love seeing what you have done. I love seeing what you have done. I love seeing what you all have done. To bring all done. To bring all done. To bring local coverage of local coverage of local coverage of local government here at local government here at local government here to our county to our county to our county. And I think you're a trusted, and I think you're a trusted, and I think you're a trusted source. Going back source, going back source, going back from the weekly brand to now the weekly brand to now the weekly brand to now the daily news brand, daily news brand. daily news brand, and so I'm very much interested in your endorsement. I think my background and my experience in state government and federal government, my advocacy work over the career. Erica, 20 years of experience in public policy work. I would bring that into local government. I'm involved in the community where I serve on the city commission that helps with affordable housing and homelessness. I'm on the board of directors of Resources, which also runs the Restored, works in environmental policy and sustainability policy in our county, and I've been on the board of Walking Democrats. I've knocked on doors for a lot of candidates, and have knocked on a lot of doors for myself.
The timing is fortunate in a way, I guess, if you're looking at the glass half full thing here, which I don't normally do as a voter. But I think it's a fair thing to say that there seems to have been
I'm an active campaigner. We knocked on
an evolution in local thought about
$1,000 for the primary,
and it's moved quite a ways. And the fact that we have a chance to start fresh with a new facility and a new system to deal with that might be opportunistic if it is approved. If it's not approved, because even then you're looking at 5 years till you get facility.
And that's the energy I would bring into office. One of my models looking forward on county council is I really like what Councilmember Keene Galloway has done coming into office, and we have similar backgrounds. She was a staffer for elected officials. I was a staffer for elected officials, and you see her coming in, writing ordinance and being a legislator. And I would be an active legislator in this county. Looking at this idea of as the salary increases for county council members, I think there's a new demand being set. That this is a full-time job, and I would see it as that, and I would be active in this community, to help with some of these big challenges, that we've been talking about today,
Yeah, I think we're probably more at the point of adaptation of the
Okay. Thanks again for joining us.
Thank you.
Yes.
Thank you.
Yes.
Thank you. Thanks for your time.
Okay, you can. And you're out. And you're out. And you're out. Cynthia, yeah, we're out. Cynthia, yeah, we're out. Cynthia, yeah, we're out.
So I think if we
Okay, you can.
into the future, I think that'll help us to then step on
Okay, you can.
what we need to do. And there's so much. I mean, there's so
And you're out.
when you look at sea level rise.
Cynthia, yeah, we're out.
That will be underwater someday. like Sandy Point. You know, there are other communities that with flooding, you know, may not make sense to continue to have people to live in places to help people. And there are places where we can do things like lift up a road, Slater Road. That should be a partnership between Lummi Nation and the county, and we could probably look to federal dollars on that project, maybe state dollars, to lift Slater Road so that Lummi Nation can get in and out during periods of flood. So I think there's a lot of that we need to look into. I think also our agricultural economy. I think there's a pretty good question here about what does the future look like for berry production in our county. There have been issues in the past, you know, of some cold springs that have had impact. Then it heats up too quickly and it cooks the berries in the fields, and that's a big part of our economy. So I think looking at how is it that we help our local farmers adapt to climate change. And that is an area where there is some state and federal money for some of that. So I'd be interested in looking into how is it that we put ourselves as a county in best position to attract state dollars, to attract federal dollars for some of those initiatives. And I think one way to look at that is the idea of the change in our energy grid towards electrification and the whole future of different types of energy sources. Congress put in a lot of funding for that, and that funding is going to be out there for probably the next decade from the Inflation Reduction Act and the infrastructure bill that came through. And we've seen Rick Larson has done a pretty good job, and our two U.S. senators have done a pretty good job bringing federal funding into Whatcom County. So I want to make sure we're in a good place for that future. I think there's opportunities for us as well. That I think we could be at the center of the energy transition. We are involved in our current energy economy with Cherry Point, and there's a lot more I think we can do looking to the future. We've done some of that from things like Corvus Energy coming into Fairhaven doing marine battery technology, the electric bus manufacturing that's coming into Ferndale, and companies like Silfab doing solar in our county. County Council is making changes to wind production in our county. So I think there's a lot that we can do to bring those jobs to our county so that we're also benefiting from that transition. We're bringing those jobs here, which then I think can help with our affordability issues in our county.
All right.
Well, thank you for joining us.
Thank you.
Is there anything we haven't asked you about that you'd like to say a few words about, or just take a couple minutes to make the case of why this board should endorse you?
Yeah, well, thank you. And I appreciate that you all are doing this process. I was really excited watching it last year, you know, as a reader, as a subscriber, as a voter. And I am definitely interested in your endorsement. You're a trusted institution. I love seeing what you all have done to bring local coverage of local government here to our county. And I think you're a trusted source, you know, going back from the weekly brand to now the daily news brand. And so, you know, I'm very much interested in your endorsement. I think my background and my experience in state government and federal government, my advocacy work over the career, I've got 20 years of experience in public policy work, and I would bring that into local government. I'm involved in the community where I serve on the city commission that helps with affordable housing and homelessness. I'm on the board of directors of Resources, which also runs the Restore and works on environmental policy and sustainability policy in our county. And I've been on the board of Whatcom Democrats. I've knocked on doors for a lot of candidates and have knocked on a lot of doors for myself this summer. I'm an active campaigner. We knocked on almost 8,000 doors for the primary election. We've got ambitious goals here for this fall. And that's the energy I would bring into office. One of my models looking forward on county council is I really like what Councilmember Kaylee Galloway has done coming into office, and we have similar backgrounds. She was a staffer for elected officials, I was a staffer for elected officials, and you see her coming in, writing ordinance and being a legislator. And I would be an active legislator in this county. Looking at this idea of as the salary increases for county council members, I think there's a new demand being set that this is a full-time job, and I would see it as that. And I would be active in this community to help with some of these big challenges that we've been talking about today.
Okay.
All
Thanks
right.
again for joining us.
Thanks.
Thank you.
Thank you. Thanks for your time.